Now let's talk about hemochromatosis. Hemochromatosis is a disease, usually genetic disease, which causes too much absorption of iron. There are problems in the inhibition of absorption of iron. Hepcidin, one of the important protein that is created by the liver, which is function is to don't let too much iron to be absorbed, inhibit the absorption of too much iron. This is the role of epsidin, and epsidin can be mutated, damaged in hemochromatosis. Hemochromatosis is a genetic disease. There are four types. The first type with the genetic disease in the gene FAHFE is the most common one. Let's look at this. So you can see there are four types. Those are the four types. The most common types is with the FHFE type with this gene. It has a mutation in this area. One very interesting thing is that one, it should be usually homozygote to be presented even, but even patients who are homozygote to this mutation, many of them don't develop a disease. You can see how frequent and how common it can be seen 1 to 200 in Northern European ancestry in USA. This is quite high prevalence, but most of them or many of them they don't even develop a clinical disease. It's just a genetic mutation without an apparent clinical manifestation. Sometimes it's heterozygote, and those patients even have a lower incidence of the disease. Another thing is that the disease takes a lot of time to develop. Namely, sometimes it's not even apparent in the starting phases of the disease, and only later on it developed. Other types is the juvenile type with this mutation in the transferrin receptor and the fourth type is the ferroportin disease. This is the mutation. Okay, but again, type 1 is the most common type. Okay, now transferrin ceruloplasmin can be deficient. Now, transferrin is important to absorb iron, or let's say another thing. Uh, Transferrin absorb iron that enter the portal system not bound to transferrin deposit in the liver. Transferrin is important to take the absorbed iron and transmit it to the tissue it should be in. Therefore, because sometimes there are problems with transferrin, iron transfer to sites of red blood cells production is reduced. Namely, it can be stuck in the liver and cause damage there. And liver damage is one of the most common complications of hemochromatosis. So, transferrin can be damaged. Now, remember, transferrin role is to take the absorbed iron and distribute it to the tissues. Now, another thing that is important is the ceruloplasmin. Ceruloplasmin is important to convert iron from this Fe2 plus to Fe3 plus, and we need it in order to bind the iron to transferrin. Uh, if there is a defective, again there is accumulation because the iron cannot travel to its distance. So ceruloplasmin can also be defective. So again, in normal patient, in normal men or women, we have this amount of iron, and you can see how high the iron can get to in hemochromatosis. Again, it cannot be recurring. This we already talked about. It takes time until it can have a clinical manifestation. Okay. Here they are talking about hepcidin. Hepcidin should inhibit the absorption of too much iron, but it's defected in those diseases, in those types of hemochromatosis. So there is too much iron that is absorbed. Now they're talking about how the iron overload can cause damage. And they are talking about oxidative stress and cytokines and things like this, but there is tissue damage. There is tissue damage, and it can be in many organs. In the liver, but not only. It can be in the liver, it can be in the pancreas and cause diabetes. It can be in the pituitary gland and cause hormonal dysfunction like diabetes insipidus with ADH deficiency, or LH and FSH can be damaged. So hypogonadism, which is a hypogonadotrophic hypogonadism, because it damages the pituitary. It can also cause erectile dysfunction. Again, hormonal, neuronal damage. Uh, we'll see it. Okay, here are the symptoms and signs. So about the signs, I want to show you the ferritin can be very high. So you can see in hemochromatosis high iron, they must have, oh, here, they talk about it here. There will be high iron and very high ferritin, which can get to 1000 and even more. Uh, Transferrin saturation will also be high. Uh, Transferrin saturation above 45% is a predictive value, is related to see that usually the transferrin saturation is more than 50, the iron serum iron is elevated, and usually also the ferritin is much elevated. So what are the signs and symptoms? You see that it takes time until the sign and symptom starts. In type 1, you can see erectile dysfunction because the hormones are damaged, because pituitary is damaged, because uh, the vascular system can be damaged, because they can have diabetes. Diabetes can increase the risk for erectile dysfunction because iron can deposit in the pancreas and cause pancreatic dysfunction, and insulin can be damaged therefore, and there can be diabetes mellitus. Glucose tolerance, we talked about it. Hypothyroidism, okay. Liver damage, which can cause, this is one of the most common complications. Cirrhosis can develop, hepatocellular carcinoma can develop, cardiomyopathy, the second most common, uh, porphyria, which is a disease of hem development. Okay, so diagnosis again, ferritin will be high, serum fasting serum iron will be high, and transferrin saturation will be high. Genetic testing, you saw each type to which gene it is related, and sometimes liver biopsy. Okay, you can see the values here for how high the serum iron, how high the transferrin saturation, and how high ferritin can be. Okay, here's the mutation. Here, this is very interesting. 70% of patients with homozygous to this mutation in the HFE1 HFE gene, they have elevated ferritin, but only 10% have evidence of organ dysfunction. This is in relation to the idea that maybe there are many patients who have hemochromatosis genetically, but clinically they may be asymptomatic. Clinical significant iron overload is even less common in patient heterozygote. Okay, so type 1 can be checked by checking the gene, but type 2 to 4 is less common, so less available genetic test. Okay, MRI can show the damage to the liver. Elevated liver enzyme can show damage to the liver. Okay. And when there is family history of hemochromatosis, we can screen for the genetic mutation. Treatment is mainly phlebotomy. It is the most cheap and the simplest and the most cost-effective treatment. You can reduce about 250 milligram of iron each time you are doing phlebotomy and taking 500 milliliter of blood out. Okay, so those are the indications to start phlebotomy. Elevated ferritin levels and elevated transferrin saturation with clinical manifestation, but asymptomatic, it's better only to consider just to monitor them. Okay, so we talked about phlebotomy, and it's a very good way to treat this. Okay, this is follow-up about the complications: diabetes, hepatocellular carcinoma, erectile dysfunction, cirrhosis, cardiomyopathy. Diet: don't consume too much alcohol because it can increase iron absorption. Don't consume too much vitamin C because it can increase iron absorption. Okay. In type 4, phlebotomy is not really working very well, so it's a problem. Okay. So this was about hemochromatosis using Merck manual. Here, by the way, they showed you how patient with hemochromatosis can have much higher hyperpigmented skin than patient without. This photo shows a comparison of hands of a healthy patient and a patient suffering from hemochromatosis with arthritic deformities. Also, by the way, the joints can be damaged in hemochromatosis. Okay, so this was about hemochromatosis. If there are any corrections, please correct me. Thank you very much, and this is it. Thanks for Merck.